trainer at the National Children's Advocacy Center. She has 20 years of forensic interviewing experience and has conducted forensic interviews in both children's advocacy centers and hospital-based child medical evaluation settings. She has provided expert witness testimony for criminal and civil court proceedings in multiple jurisdictions. In addition to forensic interviewing, she has provided therapy services to child victims, has taught evidence-based parenting interventions in CAC settings, and has also served as a family advocate on a multidisciplinary team. She has presented on forensic interviewing topics at state and local levels and has helped to train law enforcement officers on effective responses strategies to child maltreatment and child witness to violence through Greensboro, North Carolina Police Academy. Kim received her Master's of Education and Counseling from the University of Toledo and is a licensed professional counselor. She has also completed 2 years of additional training in the trauma-focused cognitive behavioral therapy program through the North Carolina Child Treatment Program. And we are very, very excited that she is here with us. 6 objectives that we're going to be talking about today. You can see them listed there. The first 3 I'm going to go through fairly quickly because I really want to save most of the time talking about how we can adapt forensic interview protocols to accommodate the presentation of ADHD children as well as the needs that they have for being able to communicate about their experiences. So, and again, I won't go through these, but you can see there's 6 of them. So let's go ahead and get started with the historic overview, again, real briefly. And the point that I'm really wanting to make with you is that ADHD has really been around for a long time, as you can see from the date of this quote by Sir Alexander Crichton. He was a Scottish doctor, and these were his observations back in 1798. He noted a disease of attention, and he was actually very prescient for his time because he thought it might either be born with a person or maybe the effect of accidental diseases, which is kind of the current thinking about ADHD, as well as noted that it's generally diminished with age. And again, sometimes we see that and sometimes we don't. But fast forward then to the early 1950s in this country when we had ADHD, which was part of the DSM, and starting with the first DSM, ADHD was classified as minimal brain dysfunction, and then it became the hyperkinetic reaction of childhood. Then with the third revision, the terms that we are familiar with now are more familiar with attention deficit disorder. That was shortened to attention deficit disorder with or without hyperactivity, and ADHD. And the thing that I want to point your attention to is that up until the current revision of DSM, which is DSM-5, ADHD was classified as a behavior disorder. So now with DSM-5, you will find ADHD diagnostic criteria listed and as a neurodevelopmental disorder. And this really reflects the last 20 years of research into ADHD using brain scans and some other technologies that have enabled researchers to be able to take a look at what is going on inside the brains of children and adults who have ADHD. So the diagnostic criteria that is currently in place in the DSM-5 is taking a look at 9 core symptoms of either inattentiveness or hyperactive impulsive, and a child can be primarily inattentive or primarily hyperactive impulsive, or it can be combined. This diagnosis does apply to adults as well. Another change with DSM-5 is that to meet the diagnosis of ADHD, it's not necessary that someone is impaired, but a reduction in life quality is sufficient.
There's also a lower symptom threshold for adults, and the age of onset, one could have had interfering symptoms of ADHD by age 12 and still meet the diagnostic criteria. So some etiological theories, and you can see that big pie chart there, that the theories, and these are theories, that it is primarily a genetic disease. If you think back to our Scottish doctor that we saw a few slides ago, he seemed to be right about that. A person can be born with it, or it can become from other causes. So some other things that are thought to contribute to ADHD are low birth weight, that first pie chart there, fetal alcohol syndrome, lead exposure, smoking, maternal smoking, and other perinatal types of insults and exposures to the child. But again, that big pie chart there indicates that that is largely an inherited disorder. Just a slide here and some note about the brain abnormalities. And ADHD is the most imaged child psychiatric disorder. And as you can see by the little model of the brain, there are multiple functional and structural neural network abnormalities that have been observed with ADHD. There are deficits primarily, but in the areas mediating executive functioning, but in also areas of the brain. And some longitudinal studies suggest that this is an issue of brain maturation. And again, thinking back to the Scottish doctor, he said that it's generally diminished with age. So just a quick note about prevalence by gender. This is actually from 2011. I think the prevalence rates have creeped up a bit. And this is comparing a couple of different things. The overall rates in 2003 and 8 years later, and also the rates between males and females. And as you can see consistently, that boys are more likely to be diagnosed with ADHD than girls, and overall rates of diagnosis have climbed upward. Okay, I think that it's really important for our conversation that we talk about this idea that sometimes trauma reactions are mistaken for ADHD. Particularly with the population that we work with. They're coming to advocacy centers because something traumatic has happened to them, or they have witnessed something traumatic happen to another person. And just a few notes about this. ADHD and the trauma stressor-related disorders, they are distinct diagnostic entities, and trauma is not considered to be a risk factor for ADHD. However, I think that there's some overlap that occurs, and toward the end of the presentation we're going to talk about some recommendations to try to address that. But some of the overlaps that certainly I see in my practice is that harsh parenting responses to ADHD behaviors. If all of you, it looks like, have had to interview an ADHD child, some of you may have children who have ADHD of your own. And what is generally clear is that these children can be really difficult to parent. And so, again, we see that harsh parenting responses. Another overlap that I see is that often children with ADHD have social difficulties, and they have trouble with establishing good peer relationships, and that can leave them more vulnerable to sexual predators. The final overlap is that the idea severe ADHD again can make it very difficult for parents to parent children. It can also make it difficult for consistency in daycare, particularly after school. We hear a lot of things about children with ADHD behaviors being kicked out of daycare, being kicked out of their after-school programs. So often this can put parents in a position where they maybe have to look for care that may not be ideal or maybe somewhat substandard. For example, a relative may have to watch the child versus the child being able to go to daycare. This is a chart here, and this is not an exhaustive list of the symptoms of either ADHD or a post-traumatic stress disorder. But there are some things that I think that can frequently overlap. So at the top, we've got some frequently observed things with post-traumatic stress disorder, and you can see how some of these things may look like ADHD or vice versa. For example, a hyperactive, impulsive child who is physically restless, perhaps that can look like a child that's got some hypervigilance. The inattentive ADHD may be confused with problems of concentration that we see in post-traumatic stress disorder. And some of the reckless or self-destructive behaviors may look like some of the peer difficulties we see with ADHD kids, that intrusion on others. Okay, so let's talk now about what are the forensic interview impacts, and what's important, what are some things that we can do to try to accommodate this. So a lot of impacts in the area of language. Children with ADHD have difficulty with those first three things: managing conversations, understanding the context. Sometimes they are misunderstood by their peers, or they misunderstand, particularly social context. They may have difficulty engaging in narrative discourse. And if you look at those things and think about what we are doing in forensic interviews, it's pretty easy to see why the forensic interview setting can be challenging for both the interviewer and the child. Some other interview impacts are going to time perception. Children with ADHD do not have typically good time perception. And then the mechanics of one, attending to questions, listening, and monitoring the responses. Sometimes kids with ADHD have a tendency to lose their train of thought, and so they may drop off in the middle of a response. And then that category of organizing and retrieving memories. I want to talk a bit about executive function. I think the best analogy for executive function, and it's probably one that you've heard because it's a common one out there, is that of an air traffic controller who's asked to keep track of multiple airplanes that are in a particular airspace and make sure that everybody is in its place and the timing, so that there aren't mid-air collisions or on-runway collisions. And so that's the same thing with executive function, being able to manage tasks, to think about what you have to do, and to be able to shut out any intrusive thoughts. So some requirements for executive function are this cognitive control, intentional flexibility, being able to focus your attention, inhibitory control, kind of really not giving in to an impulse to do something, and then this idea of short-term memory, and that's kind of remembering the things that you are supposed to do. So what are the considerations for the forensic interviewer? First of all, expect a broad continuum of ADHD manifestations. You may have some kids that you are aware of an ADHD diagnosis, but you would never know it to look at them because they have very coherent, organized thought processes, and they are able to attend to questions, and they don't seem to have that physical restlessness. So like so many other things, this is a psychiatric disorder, neurodevelopmental disorder that really exists on a continuum from mild impairment to significant impairment. And that's actually part of the diagnostic criteria. The other thing I think that we all need to be aware of is that kids who don't have an ADHD diagnosis may exhibit some of those same behaviors of having difficulty communicating, speaking quickly, just a difficult time remaining still. I think some of that does owe to the trauma that they've experienced, as well as the anxiety that a lot of kids feel when they're in a forensic interview setting. So diagnosed you might have a difficult time differentiating, and that's what makes it essential that we try to get as much pre-interview information as possible. Want to talk a bit about ADHD and lying. I know in the interviews that I've done, parents will mention, I'm not sure about this. He or she, they have a tendency to lie. And the reality is that frequent fibbing is not unusual. And like most kids and kids with ADHD, I don't think are an exception. Most of their fibbing, their confabulations are going to be to avoid getting into a situation, getting out of a situation, to cover for something that they've done, something that they were supposed to have done, and not so much for getting themselves into a situation. It's not typically an act of defiance. For a lot of ADHD kids, these untruths are usually related to incomplete homework, test preparation, chores. If any of you out there have a child with ADHD, you probably know exactly what I'm talking about. And very often it's a defense against some overwhelming challenges. For example, doing their homework. This may be extremely challenging to do it, so it's easier just to say, yeah, I did it. Same thing with cleaning the room. Okay, so let's talk about pre-interview information and the kind of things that we are needing to get from parents. You want to ask about all diagnoses and especially related medications. Is a child who you are aware has an ADHD diagnosis, are they served by an IEP or a 504 plan? And what, again, is their ADHD presentation? And this relates back to the diagnostic criteria. Often I just will ask parents, do they have difficulty paying attention, sitting still, or both? And is this mild, moderate, or severe? Some other information that I think is essential to know is if they're on medication, what was it given to them on the day of the interview and at what time? Second point that I find really helpful, and this is generally applies to older children, maybe 12 on up, especially adolescents, I like to ask the parents what their child's awareness is of this diagnosis. For some kids with ADHD, particularly if they've had some very good educational interventions, they have a good awareness of the kind of things that are going to help them to be able to communicate. And you want to make sure to document any information related to their ADHD diagnosis or treatment. Another aspect of pre-interview is finding out, this is a person who does your scheduling, if they're aware of an ADHD diagnosis, what is this child's optimal attention times? For a lot of kids, especially ones who take medication, late in the afternoon, that medication is wearing off and it's not going to be a good time for them. And what we tell parents is if your child needs medication for school, it's going to be helpful for the forensic interview. We've had occasions where parents will not give their children their medication, and the explanation is, well, we just wanted you to see what it is that we have to contend with. But that's not going to be helpful. And does the parent have the current IEP or 504 plan available for review? By law, parents are provided with copies of these educational plans, and is this something that they are able to share with you? All right, so the pre-interview, the day that the child actually comes to the CAC, you want to be very careful to make sure your interview rooms are cleared out of excessive things. Big proponents of orientation, and that typically takes the form of giving a tour of the interview room, explaining the recording, explaining who's going to be observing. And we feel like for all kids, this really establishes a predictable structure. It's especially important with children with ADHD because they tend to respond positively to structure. Want to make sure those kids have got handheld games or phones, and just a quick check and make sure that they're left with a parent or caregiver. I think that's good policy anyway, but for a child, again, who's got that inhibitory control, it may be really hard for them to sit and talk with you and not think about wanting to look at their phone. The things that we suggest having in the interview room are different types of paper, plain and lined paper, an easel, and markers for children to be able to draw, index cards, and I'll explain about the use of that later. We are proponents of Play-Doh here at the NCAC, but not a lot of Play-Doh, so just two things of Play-Doh, maybe 2 to 4 cookie cutters to make shapes. Anything beyond that, I think, is going to challenge the child's attention. The other thing that we suggest having in the room, and I will speak more about this in detail, are what we call fidget items. All right, so I'm going to go through different stages of the interview, and you will see that this is, if you have been trained on the NCAC model, this reflects our stages. But these are things that I think can be readily adapted to other forensic interview models and protocols. So the first part of the forensic interview, again, as I stated, these kids will respond better to structure, clearly stated expectations. You want to make sure that you adhere to a protocol, and the rapport, the rules, the narrative practice piece is going to be especially important. So begin the interview and continue this throughout. Speak at a relaxed pace. Sometimes if you have kids that talk very rapidly, you can get them to slow down by slowing your pace down somewhat. You want to maintain, again, that neutral eye contact, and frequently refer to the child by name. That really has an orienting effect. And I also just think that's good forensic interview practice that you can do with all kids. For ADHD kids, again, it can help keep them oriented and focused. A lot of what I'm going to be talking about for the next several minutes really also does reflect good forensic interview practice, and these are things that I think are going to be helpful when you talk with children who have ADHD, but they're also things that I think are applicable to talking to a variety of children. So in the early engagement, and again, this is going to reflect back on that conversation you had with that parent about the child's awareness of their diagnosis. So if I, for example, have a parent of a adolescent, it typically is, who says that their son or daughter is really familiar, understands their diagnosis, is responsible for giving themselves their medication, I will acknowledge this at the beginning of the interview, something very simple like, I understand from talking with your mother that you have attention deficit disorder. I asked the child to tell me about medication, what they're taking, when did they take their medication, and this question, and that is, what helps? What helps you when you have to pay attention to questions and give detailed answers? And very often kids will say, well, it will help me if you can repeat questions. It helps me if I have something to do with my hands, or it helps me if I can walk around when I'm talking. Again, these are kids who maybe have benefited from some good educational intervention, and they've been able to learn some very good adaptations for themselves. So in early engagement, we may have limits to set, and what I say is avoid power struggles, and you want to do this anyway, but you especially want to avoid power struggles with children who have ADHD, but you may have to set limits. So if you do want to state the limits in a firm but friendly manner, and the important thing to remember is to request the desired behaviors in positive terms. So please keep all 4 legs on the floor versus don't rock the chair. You want to offer choices when feasible. We see here this little girl getting ready to chow down a big old thing of blue Play-Doh, which I consider that safety. I would try to set a limit on that because I think it could make children sick. We're all the hands that touch our Play-Doh every day. But so a choice. So Play-Doh is for making things. Do you want to roll or use the shape makers? All right, so moving on to the interview instructions, very important, again, because ADHD children really benefit from that structure, knowing what to expect. So I would be very mindful of including those interview instructions. and also reinforcing them throughout the interview. And what I mean by that is any time that a child corrects you or asks for clarification, to stop and thank them for doing that and say, that's exactly what I want you to do. One of the things that we're going to talk about a few slides down is this idea of summarizations. That can be very effective in interviewing children with attention problems. And so what I would say is that if you're going to summarize, that you want to preface that with that reiteration of correct me. So I'll often say things like, now remember, I'm going to tell you what you told me, but I want you to listen carefully if I get it wrong. Helpful, I think, across the board, but especially for a child with ADHD who may have forgotten that. Moving on to the narrative practice, extremely important because not only does this give you an idea of this child's communication abilities, but for children with ADHD, it really is going to let you hone on things that might be a problem as you transition to talking about the topic of concern. So in narrative practice, what I would say is watch for any kind of listening difficulties. Does this child just not seem to understand your request? This is probably where you may see some fidgety behavior, some extreme restlessness. This will usually be about 10 minutes or 5 to 10 minutes into the interview. And most kids, even with ADHD, unless it's extremely severe, can kind of hold it together for a few minutes. But these are the things that you'll start to see as the interview goes on. So the timing is really helpful. So you may see some fidgety behavior, some restlessness. Want to watch out for any unorganized thought processes. For example, did they jump from topic to topic? Again, in the narrative practice, we're asking kids to sequence an event. And can this child do that, or do they really have a difficult time sequencing? For example, do they start and they jump around, and maybe you ask them to tell you about their morning, and they're talking about something that happened last night. It's a time to observe. Also, you may see kids that have got that excessive but very rapid talking. Other thing to look out for is, again, does this child just have a tendency to lose his or her train of thought? So if you see those things, then what I would say is just kind of make a note of it. You may not see, hopefully you won't see all those things with kids, but as I said a few slides ago, there's a broad continuum of ADHD manifestations, and just because a child has ADHD does not mean that they are going to really have significant symptoms that will interfere with their ability to talk with you. But if the narrative practice reveals some barriers, you want to try to address that before you transition to the topic of concern, and just try to match it. So here are some additional instructions that might be helpful. I like this one if I have, it's really clear to me that I've got a rapidly talking child. I'll just say, I want to make sure I hear everything you say. I might need you to slow down, and just, you can think of whatever signal. This is important because we really don't want to interrupt children in their narratives, but yet if they are talking so fast that it's difficult for you to pay attention and difficult for your observers to pay attention, this may be something helpful to do. Some other additional instructions, and the first one would be if I notice that this is a child that is on the hyperactive side and really just has a lot of physical energy, just to really normalize it. That I talk to kids, they have a hard time keeping their body still, and tell them it's okay if you stand and move while we're talking. And this is where these fidgets come in, and there's some of them there you can see some Play-Doh, but some squeezy kind of things. And actually, it has been found that fidgets can be very, very helpful because they let the ADHD child sort of release some of that physical energy onto an object, and it can actually make them more attentive to the task at hand, which is thinking about their experiences in talking to you. Other kid instructions, and this may be for more inattentive kids, I just really ask them to tell them I'm going to ask a lot of questions, and I might ask you to give some long answers, but if you can't remember what I asked, just tell me. Or if you forget part of your answer, please tell me. And this third one here is that sometimes kids with ADHD, and all kids, just might need to take a break, but you want them to really have that freedom. And say if it starts to get hard for you, just let me know. Please tell me. I want to talk about this idea, which I think is helpful for kids with ADHD, as well as maybe younger children, this notion of using scaffolding during forensic interviews. And scaffolding really borrows from educational, instructional philosophy, and it's the idea of breaking up chunks, information into manageable chunks, and then providing structure to the chunks of information, and then considering one at a time, and really clearly communicating a focus shift to different chunks. And we're going to talk about some different ways that we might do this in the forensic interview. There's two different types of scaffolding that I want to talk about, and both of them I think can be very helpful with children with both inattentive and hyperactive ADHD. And the first is detail scaffolding. And again, ADHD children, as well as younger children, are likely to need consistent verbal scaffolding. So I'm going to talk about what this is. You want to keep your narrative request open and short, but with enough specificity to anchor the child to the context. So the example here is, if you ask a child, tell me what you think you came to talk about, and they say, Uncle Don's been hurting me. You want to make sure that it's tell me more about Uncle Don hurting you versus tell me some more about that. Again, you want to borrow their language and really focus on repeating the pronouns and the acts that they give you in the language that they are using. And if the child's initial narrative response, and again, this is after you transition, ask the child to talk about what they think they came to talk about, the purpose of their visit, and again, you want to invite them to give you that narrative response. If it suggests like multiplicities, and I'm talking about multiplicities of acts, of perpetrators, of locations, you want to listen very, very carefully, because what you're going to want to be doing is trying to identify words that you can use to label those information chunks. We'll talk about how that works. So for example, if a child articulates, again, multiple events and perpetrators and acts, and this is where those index cards that I suggested you have in there can come in very handy. So use their language. So if a child says to you, Uncle Don's been hurting me, he hurts me, and child names like 4 different locations where Uncle Don hurts them, then you can generate cue cards. So you said Uncle Don hurt you at your house, and in his truck, and in his shed, and at the lake. And those become labels that you can use to help with that detail scaffolding. So what I would suggest is writing, each thing, and it may be an event, it may be perpetrators, it may be acts, but writing them on a separate card and making sure that you ask the child to verify. Now, you told me about, again, Uncle Don hurting you at these places. And then what you're going to want to do is just focus on one card at a time. So you said that Uncle Don has been hurting you at the lake. Let's talk about everything that happens at the lake. And try to go through that. We're going to talk about another type of scaffolding that is parallel, and they also help in this, which is a sequence scaffolding. But for now, this idea of being able to separate, again, that child's narrative into these chunks. You want to very clearly communicate your transition. So after you've asked the child about everything, so tell me everything about Uncle Don hurting you at the lake. And when you have an idea of that, You get out the other card, and so you also said that Uncle Don did something in his truck. Again, you want to really clearly communicate the transitions. This may be a place, if you have a child that's got multiple incidents, a child certainly who has got some polyvictimization, that it may be that you're not able to cover everything in the context of one forensic interview. So sometimes you may have to cue for these labels. So some possible cueings is that you ask a child if they've alluded to multiple perpetrators and they've gone through those perpetrators. I want to know, tell me all the names of all the people who've messed with you. Again, you want to make sure that you use their language. If you're talking about different things happening to their body, all the parts of your body that have been touched and hurt, or locations, all the places where bad stuff happened. We see a lot of kids with ADHD that have got with concerns about physical abuse. So all the reasons you get whooped, again, if that's their word for physical punishment, all the things you get whooped with. And this is all going to represent an opportunity, again, to chunk that information and let the child focus on one thing at a time. For some other pointers about detailed scaffolding, and we've touched on this somewhat, is that you want to avoid pronouns and adverbs, so things like that or he, she. Use the names, the locations, the acts that the child articulates. I think this is good forensic interviewing practice, but when you have, again, a child with attention difficulties, they can lose track, and so you really, your role as the interviewer is really keep them anchored to these things. Paraphrasing, a reflection can help maintain the focus. And as I said earlier, if you're going to do that paraphrasing or that summarization especially, I would say preface it with, if I'm wrong, tell me. And the point in the middle there, since children with ADHD, they're going to have difficulties with time, as much as possible, seek the temporal details from that context information. And separating out those chunks can really help you to do that as well. So I'm going to talk about another type of scaffolding, and again, I think these things can be used together, and that's a sequence scaffolding, and that's because the tell me everything that happened from beginning to end is going to be too broad for many ADHD children. It can be a very difficult question for younger children, and the commonality they have there is those difficulties with language and time perception. So what you want to do in sequencing scaffolding is break the sequencing down. And if I have a child that in narrative practice showed me they just couldn't sequence, then I'll go right to this. So for example, if they tell me that they're here, again, there's Uncle Don hurting them. Tell me what you think you came to about Uncle Don hurting me. So break it down. What happened first when Uncle Don hurt you? And just really providing structure to that sequence. He pushed me down. And then what you want to do is embed part of the response in the follow-up question. So what happened after Uncle Don pushed you down? Or you can repeat, Uncle Don pushed you down. What happened next? And so in that way you can really chain a sequence together, but you want to go along. So for example, the child said, what happened next? He pulled down my pants. Uncle Don pulled on your pants. What happened next? And again, helping them to organize that sequence can be really, really helpful. Okay, so I want to talk about drawing, because I think there's potential benefits for a lot of kids, but especially kids with ADHD, drawing, I think, can do a few really important things. In one, it can redirect some of that excess physical energy. That's the same theory behind the fidgets, just giving them something to do with their hands. But it also can provide a good conversation focus and reveal forensically relevant information. I'm going to give an example from a child that I interviewed. Some of you who have been to Huntsville and have gone to our basic class, this is the little boy that was throwing the big Play-Doh balls around at me. But anyway, he was a physical abuse, and some severe physical abuse. And he was really able to calm down when I asked him to draw what he had been hit with. So that kind of redirected his energy. But then that also gave me something to direct the conversation. So you said that you got hit with this, and tell me all the places on your body where you got hit with this. It was a hose, and what did that feel like? In drawing that was also really helpful for the investigators because he drew some specific details on it that they could go and find. So some things that you can direct kids to draw is, again, what were you hit with? If it's a specific belt, or we have kids that are hit with paddles that have sayings on them, again, that can represent some forensically relevant information. The other example is the room you were in, goes Uncle Don again, or all the rooms in Uncle Don's trailer. Again, can focus the conversation and really reveal some of that relevant information that can be helpful. I wanted to just touch on the use of props, and what I'm talking primarily about here are, with this particular study, is the human figure drawings. Sometimes I think with kids with ADHD, it may be tempting to say, let me just give you this to focus. But I want to just caution you about that. Now, I also want to explain that this study by Poole, Dickinson, Brubaker, Liberty, and Cake, which is a couple of years old, really interesting study, and they were not looking specifically at ADHD. But what this was a follow-up study that they had done. It was an eyewitness study, and it was an analog study where they set up a paradigm of a person, somebody breaking a germ rule in touching kids, and they used human figure drawings to elicit disclosures. And what they found is that there were some kids in this group that what they termed exuberant false reporters. Like they pointed to many, many places on the drawing. And so they did a follow-up study. They had these kids come back, and they did specific tests to gauge their cognitive control. And what they found with this group is, and this was 4 to 9-year-olds, is that this idea of cognitive control was a better predictor than age. So, for example, kids that had poor cognitive control were more likely to be in that exuberant false disclosure group. And another conclusion, again, we see this role of executive functioning. So kids with limited executive functioning, and as we know, that often that's kids with ADHD, that may lead to thoughtless reporting. So you do want to be careful with using those kind of things to especially to elicit a disclosure. And so that study is there for you. And again, it's a very interesting one. But clearly they did not screen for ADHD. One other interesting thing that they did find, though, is that most of the exuberant false reporters were boys. And again, I think it's good cautionary for us. So we've gone through the forensic interview, and we want to think about post-interview, and this may fall to your advocates. But I think it's really important in this, lending back to the idea that there may be some symptom overlap, that kids that really have got trauma symptoms may be presenting as ADHD, maybe they're misdiagnosed, they may be diagnosed with both, but really advocate for a good trauma screening for these kids so that we can get an idea of what role experiences may play in their presentation. The other thing that I think is important is trying, if you have parenting classes in your community, to really try to advocate for parents to be able to participate. As I said earlier, children with ADHD can be very difficult to parent. I think a lot of the physical abuse and appropriate discipline comes from deficiencies in parenting. And some parent-caregiver support. There's actually a lot of really good information out there online. And just, and again, this may fall to your advocates or your therapists, but helping parents to be aware I find still, with all that we know about ADHD, there are parents that think that their kids are just being bad, or that physical punishment is going to make them be more attentive and, for example, not lie about not doing their homework, and that really just is not effective. The American Academy of Pediatrics a few years back issued some recommended ADHD treatments, and it was really significant, I think, in that for the younger children, ages 4 to 5, they are saying that behavior therapy really is the first line of treatment, and to try that before you try medications. For 6 to 11, ADHD or FDA-approved medications and or behavior therapy. Behavior therapy can be very, very effective. And for the older kids, their recommendation is that the adolescent should be able to give assent to the use of any medication. Those recommendations you can find on the American Academy of Pediatrics website, and I've referenced that for you in the sources. Very helpful. It's actually have some printable forms that you can make copies of.
So much, Kim.
All right.
For
You're
your
welcome.
time,
Thank
and
you.
thank you, everybody, for participating.
Take care, everyone. Have a good weekend.